Hello, and thank you for this opportunity to present my evidence-based project proposal. My name is Heather Kealos, and I have been a registered nurse in the medical surgical setting for the past 4.5 years. I am currently pursuing my master's at Regis College through their Adult Geriatric Nurse Practitioner program. This PowerPoint presentation will review the project proposal regarding compassion fatigue and staffing in medical surgical nursing. To begin this presentation, let's review what compassion fatigue is. Merriam-Webster defines compassion fatigue as the physical and mental exhaustion and emotional withdrawal experienced by those who care for sick or traumatized people over an extended period of time. This can be categorized as an extreme state of tension and preoccupation of helping those in need. There are 3 characteristics of compassion fatigue, which include burnout, traumatic events, and prolonged exposure. Burnout can occur due to heavy workloads and feelings of not making a difference. Traumatic events is the exposure to pain and suffering of others. Prolonged exposure is the absorption of this suffering over a long period of time. Why should we care about compassion fatigue? Compassion fatigue has numerous negative effects. These effects include physical, psychological, and social. Physical effects include GI and sleep disturbances, accident proneness, and poor concentration. Psychological effects include anxiety, depression, anger. Lastly, social effects include withdrawal from loved ones, reduced empathy, and frequent sick calls from work. As a patient, would you want a nurse taking care of you who is prone to accidents, anxious, and lacked empathy? Compassion fatigue affects not only the nurses, but the patients they care for. Extensive review of literature was completed through various online databases. EBSCOhost was the search engine utilized, and numerous databases were reviewed. The chart on this slide lists what is known about this phenomenon and where there is a gap in the knowledge. Let's start with what is known. Work environment has proven to affect the development of compassion fatigue. This includes heavy workloads, management, supportive peers, etc. What is not known? The effect staffing has alone on the development of compassion fatigue. Next on what is known is that numerous studies focus on compassion fatigue among pediatrics, oncology, and critical care. There is a lack of evidence in the medical surgical setting. Next is the prevalence of compassion fatigue is well known throughout areas of nursing. However, no research has been completed where factors were altered or controlled to see how it affects compassion fatigue development. Lastly, negative effects of compassion fatigue is well known in the literature. The gaps in the literature has brought us to the purpose of this evidence-based practice project. The objective of this project is to examine the effects of adequate staffing on the development of compassion fatigue among medical surgical nurses. This part of the presentation begins the methodology of this project. First, we'll begin with sampling. Purposive sampling will be utilized in this study. 9 medical surgical units at a large teaching hospital will be included. Each unit specializes in various fields. Each unit will have 10 night nurses and 10 day shift nurses participate in the study. These participants must be employed full-time, work 12-hour shifts, have at least 1 year of experience, and do not currently work in the flow pool. Participants will range in experience and demographics. A total of 180 participants will be selected. These participants will be recruited via their work email addresses. If participants wish to be part of the survey, they will click a link that will bring them to a submission form. Next, we will discuss the design method. For this evidence-based practice project, we will be utilizing an interventional survey research design. The time frame of this study will be 9 months. 1 month on each of the medical surgical units. This is how the format of the study will be for each unit. Week 1, nurses will be asked to work a specific schedule that utilizes the current staffing ratios at the hospital, which is 5 patients to 1 nurse. After week 1, participants will be asked to complete a brief 2-part survey, which will include a demographics questionnaire as well as the professional quality of life survey. Next, a debriefing session will take place. Week 2 and week 3, no required schedule, no debriefing, and no surveys. This will be a break for the participants. Week 4, nurses will be asked to work a specific schedule that utilizing the staffing ratios of 4 patients to 1 nurse. This ratio was proposed in the Massachusetts Bill and Act relative to Patient Safety and Hospital Transparency Bill, H4112. After week 4, participants will take part in the same 2-part survey and debriefing session. The 2 instruments utilized in this study is the Professional Quality of Life Scale, as well as a demographics questionnaire. The Professional Quality of Life Scale measures compassion fatigue and its 3 subscales of burnout, secondary traumatic stress, and compassion satisfaction. The construct validity is well known for this instrument, and the Cronbach reliability rankings range from 0.75 to 0.88 for the subscales analyzed in this questionnaire. The demographics questionnaire will examine the participants' age, gender, ethnicity, etc. This is an excerpt of the Professional Quality of Life Scale. Examples of items on this questionnaire is, I feel trapped at my job. I feel connected to others. I feel invigorated after working with those I help. Please keep in mind this version says, in the last 30 days, but will be reworded to say in the last 7 days for this study. After week 1 and week 4, the participants will meet in the hospital's library to take part in the demographic survey as well as the Professional Quality of Life survey. This data will be entered into a statistical analysis system. After completion of the survey, the participants and the researchers will meet in a conference room for discussion. Discussion will consist of expression of feelings about how the particular staffing of that week affected them, and notes will be taken and common themes will be extracted by the researchers. Why is this significant? This project is significant due to its ability to not only affect practice change but governmental change. The recent Massachusetts Bill and Act relative to Patient Safety and Hospital Transparency, Bill H4112, outlines safe nurse to patient staffing ratios, which range from 3-to-1 and 4-to-1, depending on the type of unit. The major selling point of this bill was patient safety. However, advertisement on the effects staffing directly had on nurses was not utilized. This research could give evidence to this debate on safe patient-to-nurse staffing ratios. This also has significance to the advanced practice registered nurse role due to the effects adequate staffing can have on members of the healthcare team, as well as ensuring that your patients get the care and attention they need with appropriate staffing ratios. Why fund this proposal? Compassion fatigue is a phenomenon experienced by nurses throughout all avenues of this workforce. The negative effects nurses feel from compassion fatigue not only affect them in their day-to-day lives, but also at their jobs and how they care for patients. This proposal will bring awareness to how staffing can directly affect our healthcare system. This proposal has the potential to influence future legislation development on safe patient ratios. Nurses care for others. We must care for our nurses. Nurses give so much of themselves each day to their patients. They give respect, compassion, empathy, and care to their patients each day. Nurses care for all of us. Let's not forget to take care of our nurses too. Thank you for your time and consideration of this proposal. This slide is the references utilized for this presentation. Articles all found on online databases. And this last slide are the references for the images utilized throughout the presentation. Thank you again for your attention. Have a great day.